An announcement that sent shockwaves through the River Valley. Baptist Fort Smith will close its labor and delivery and obstetrics units by the end of this month. That leaves one major hospital left in Fort Smith to take up the slack. 5 News anchor Darren Bobb sat down today with the Mercy Fort Smith CEO to find out what's in store at his hospital. It's a story you'll only see on 5 News.
Ryan Gehrig runs Mercy Fort Smith. He says the hospital is in a very good position to take in these certain patients that won't be able to go to Baptist after April 28th.
Every expectant mother will have a place, will have a provider here at Mercy. I can't guarantee they'll get the specific position they may want, but we have capacity for every one of those mothers.
Mercy announced just a few days ago a 3-phase expansion project totaling $60 million, which will see expanded clinic space, more space at the main campus, and open up more inpatient beds. Gehrig says it was related in a way to the announcement from Baptist last week.
We began scenario planning months ago, and the decision that was made across town definitely accelerated our need to respond and grow. And we cannot afford to lose some really talented physicians and a very committed workforce to this community, and that's what we're working to keep.
Gehrig says by no means is the level of health care going to drop off anytime soon.
This community is moving in a positive direction. There's been tremendous growth, a lot of exciting announcements, and Mercy has seen that, and that's why we've been investing in this community. The decision made 5 years ago to put $190 million into this expansion. We have a very bright future ahead. The medical community is going to grow, continue to grow as this community is growing.
He also says this expansion means an easier time recruiting new physicians.
Once we can get them to Fort Smith and tell our story, we have a great success rate at landing those physicians. And what's interesting is people outside of Arkansas, we have an easier time to recruit them to Fort Smith. Once we get them past Arkansas, it's the local people who tend to don't see all the positive things that are going on in their own community. And, but that narrative is changing as well.
Bottom line, Gehrig says this won't happen overnight, but when it does.
But when we get on the other side of this, people are going to see one of the most robust, comprehensive health systems imaginable. And I'm excited. I'm excited about what's ahead and our ability to support some subspecialty care that maybe we couldn't have done when you got two systems that are splitting the market. And so we're focusing on the positives, and there's a great story ahead for Fort Smith.
In Fort Smith, covering news where you live, I'm Darren Bobb, 5 News.
We did ask for an interview with the Baptist Fort Smith CEO, but he declined our offer. We will, of course, continue to follow any new developments at Baptist beyond the ending of labor and delivery services on April 28th.